Thanks for joining me to learn more about CBD for fibromyalgia relief. Ever since developing fibromyalgia in medical school, I've been on one long experiment using myself as a guinea pig to try and figure out what was going on in my body that caused so much pain, fatigue, and brain fog, and how I could use that information to translate into finding effective treatments for myself and for my fibromyalgia patients. Now, you might have heard about CBD or cannabidiol as a useful treatment for fibromyalgia. There's been a lot of buzz about CBD, and rightfully so. It really can be helpful for fibromyalgia. Part of why I made this video, though, is because I think there's really a lack of good quality, accessible medical guidance out there for folks who want to maybe try CBD for themselves. So in this video, I've put together all the information that I've learned using CBD for myself, using CBD with many of my fibromyalgia patients, and from extensive review of the scientific literature, reading almost every study I could find about CBD for fibromyalgia or fibromyalgia-related symptoms like anxiety and insomnia and pain. I'm also going to answer in this video a lot of the questions that patients ask me. Questions like, what fibromyalgia symptoms could CBD actually help me with? Is CBD safe? Is it legal? Where do I get it? Do I have to go to a dispensary to buy it? Do I have to have a medical marijuana card? What kind of dosage range should I be taking? What side effects could I expect? I'm going to answer all of those and more. And stay tuned, because at the end of the video, I'm going to answer the most awkward but commonly asked question of all, and that is, will CBD affect the results of a urine drug screen? So let's get started. And we're going to start with the basics, learning about what CBD is, where it comes from, and how it could help in fibromyalgia. CBD, or cannabidiol, is a chemical found on the plant commonly referred to as marijuana, but more scientifically and accurately called cannabis. THC and CBD are the two biggest chemical players in cannabis as far as from a medicinal standpoint. THC and CBD are the most well-studied for their medicinal and scientific effects. I'm going to review here what research has shown us, both animal and human studies, about the effects of these two chemicals in the body. Now I'm going to focus more on CBD because that's what the video is about, but I do need to talk somewhat about THC, how THC and CBD interact with each other, and how they're different from each other. So THC is the most famous component of cannabis, and it's really the high causer. It's responsible for the psychoactive or altered thinking effects of marijuana that typically is what recreational users are seeking. Now, it also has strong pain-relieving effects. However, the psychoactivity really limits its ability to be used as a pain reliever, because usually people seeking pain relief are seeking to improve their function, and the high can really limit their function. As one of my patients said, what good is it to me to be in lower pain if I'm stuck on my couch feeling high all day? So that right now is what limits kind of the usefulness of THC on its own as medicine for pain. It really does also have some mild anti-inflammatory properties, which can be helpful. It's been shown to reduce muscle tension and improve sleep quality. And we know a lot about how THC works in the body, and we know exactly what receptors it works on. So THC works in the brain on CB1 receptors. That's what gives it its psychoactive effects and its pain-relieving effects. THC also works on cells of the immune system through CB2 receptors, and that's what helps it to have its anti-inflammatory properties. Now, in contrast, we understand a lot less about how CBD works in the body. And part of this is because CBD seems to have effects on lots of different receptors rather than just a few like THC. One research article I was reading estimated that there may be up to 65 different molecular targets, meaning receptors, that CBD works on. In that same article, they called CBD a promiscuous molecule, which made me laugh, but also it's true. It interacts in a lot of different ways with a lot of different receptors. And that's partly why the effects of CBD tend to be more global or systemic or subtle than what you see with THC. So CBD does not activate those same CB1 receptors in the brain, which is why it doesn't have the same effects of psychoactivity as THC does. In fact, CBD doesn't have any of that classic psychoactivity effect. It does not make people high. Now, it does interact with the brain, however, and it seems to interact with neurons that are inflamed or hyperactive. That's how it reduces seizures. It acts as sort of an antioxidant in the brain, giving it some neuroprotective capacity, and there's some exciting new research about using CBD to help the brain recover from injuries like stroke or traumatic brain injuries. We also know that CBD has a lot of effects on various cells of the immune system. And that's really why it's such a strong anti-inflammatory. Unlike THC, which is more of a mild anti-inflammatory, CBD is really a very strong and effective anti-inflammatory. Now, it's a mild pain reliever, not a strong pain reliever, and it works really in the brain to kind of calm down neurons that are kind of overreacting to pain. And so you can see how in fibromyalgia that would be really helpful. But CBD does not actually act as a pain blocker like THC does. So it's not the same kind of effect. It's a more global, subtle effect, and it's kind of a combination of its anti-inflammatory effects, its muscle relaxed effects, its brain calming effects that really give it its pain relieving capacity. Now, CBD also interacts with serotonin receptors in the brain, which is how it eases anxiety and improves depression. It interacts with receptors of the fight or flight response, which we'll talk more about in the next section. And that really enables it to help calm down PTSD and fibromyalgia symptoms specifically. Now, there have been some very interesting studies done on both THC and CBD, both in animal and human models. Now, this video is about fibromyalgia, and unfortunately, as of the time of making this video, there have been no studies looking at CBD directly on its effects for fibromyalgia. Now, there have been studies looking at arthritis. There have been studies looking at CBD for nerve pain. And primarily at this point, a lot of the work has been done actually in the animal model that we're getting, although there is more interest in studying it for humans, it's still, because of the regulatory and legal issues in the US, it's still actually very hard to study CBD on humans. So a lot of what we know and a lot of what I'm talking to you about really comes from studies on animals. And interestingly, in one study looking at rats, they induced arthritis, meaning inflammation in one of the joints. And then they applied CBD both locally to that area, to the skin above the joint, and looked at what happened. And they found that both markers of inflammation and pain responses went down with CBD applied topically to the joint. And then in that same study, they tried it systemically. So they gave these rats some CBD liquid. And basically, they found the same effects. So CBD, both systemically or topically, at least in the animal model, was really effective to reduce inflammation and pain from arthritis. Now you can see in this comparison slide that there really is a lot of overlap, areas where THC and CBD both have similar effects. But keep in mind that they're doing it by working on different pathways. So although THC and CBD both reduce inflammation, they're doing it through different avenues by acting on different receptors. And what's great about this is that it means that if you are combining them together, if you're using a product that has a little bit of THC along with your CBD, you're likely to get more inflammation reduction, more pain reduction, and more muscle relaxant benefits. And I'll talk more about that when we talk about selecting a product. But basically, the way to think about it is that there's additional benefit from kind of the entourage effect, meaning more effects from THC and CBD together than from either one alone. Now you will see down here, this is where THC and CBD really differ. Here THC is listed as a sleep aid. CBD is not, although I do think CBD has some benefit for insomnia. CBD is the only one that's listed as reducing anxiety. In fact, THC is known to increase anxiety. And THC is the only one that gives that psychotropic or high effect, whereas CBD does not. Based on that review on the scientific effects of CBD that we know from research, I bet you're already starting to guess how it could be effective as a medicine or medicinal treatment for fibromyalgia. In order to really understand exactly the ways that CBD can help with fibromyalgia and what you should be watching for if you're trying CBD for specific fibromyalgia symptoms, I feel like it's important for you to really understand what's going on in the body in fibromyalgia. Of course, it would be a much longer video if I reviewed everything that we know about what's happening in the body in fibromyalgia. If you want to go more into the science and treatment of fibromyalgia, I encourage you to check out my book, The Fibro Manual, where I go into the whole story. For today, let's keep it to a nutshell, and the nutshell is this. In fibromyalgia, we know that the part of the brain that senses danger has gone haywire. That part of our brain that's like the smoke alarm, looking for danger, should only really go off when there's actually danger. And as soon as danger goes away, the response should go away. What happens in fibromyalgia is that a trauma or illness or injury triggers the fight or flight nervous system. That's our innate response to danger. And unfortunately, once the trauma goes away, the response does not. So it's like a smoke alarm that correctly responds and starts sounding when it notices smoke. But once the fire is gone and there's no more smoke, the smoke alarm keeps going. That's what's happening in our nervous system in fibromyalgia. We are continually sending out deep in an unconscious level, completely out of our control. Our brain is continually sending out these fight or flight signals, which are kind of like danger signals to the body. And you can imagine that sending out danger signals for a short term would be good, right? It's going to help our muscles to get more blood flow and be tighter so we can fight off an attacker or run away or, get out of the car if we're in a car accident, things like that. But over the long term, they can be really damaging. And what we're seeing in fibromyalgia is really the widespread effects of a constant overactivation of that fight or flight nervous system. And it's really important to understand all the different areas of the body that can affect, because that's also a lot of different areas that CBD can have positive effects on. So first, let's go over the negative effects. What's happening in response to that constant fight or flight signal that's being sent out from our brain to our body? Well, first of all, if your body is getting the signals that it's in danger, it's probably not going to let you go to sleep very easily, right? Because it wants you to stay awake and be hypervigilant and be on the watch for danger. So insomnia is a huge problem in fibromyalgia, the inability to fall asleep. The next thing that can really go haywire is our ability to get into deep sleep. Because even once we're asleep, our brain is sort of keeping us in the lighter stages of sleep, never really letting us get into those deep restorative stages of sleep. And that's really kind of a state of hypervigilance while we're sleeping. And that, as you can imagine, leads to unrefreshing sleep, fatigue, and fog. So right there, you can already see two ways that CBD could help. CBD absolutely can help with insomnia. I have found personally it's a really great treatment for insomnia. And for some people, they feel like it improves the quality of their sleep, meaning they feel like they get deeper sleep with it. I haven't experienced that personally. I've seen more the benefits for insomnia, but I've definitely had patients report that they feel like they get deeper, more restful sleep with CBD. So sleep is the first area to look for benefits. The second aspect of a fight or flight nervous system gone haywire is the emotional experience of that hypervigilance. We experience that as a feeling of anxiety or a feeling of fear. And that's another area where CBD has been really helpful, both in, I think, clinical research and also with many of my patients. And for me personally, I have found CBD to be a really effective, gentle anti-anxiety treatment. The other thing that really goes out of whack when the fight or flight nervous system is on overdrive, like it is in fibromyalgia, is because our muscles are so tight. And even while we're sleeping, they're sort of tight and ready to fight. It leads to a lot of muscle tenderness, muscle pain, and muscle inflammation. And CBD can help both in topical application over the muscle that hurts or systemically with kind of widespread body inflammation. Now that's a more subtle effect, and what I've seen is, for me, CBD topically can be very helpful only really when it's combined with other herbs. So I find it's the most helpful when I combine it with something like arnica, which also has anti-inflammatory properties. Some of my patients find that CBD just by itself is a really good topical pain reliever. And then systemically, I have found it to be mildly helpful as a pain reliever, but not hugely. It's more of kind of a global, subtle response. And I feel like it's more helpful for pain for me because it helps kind of ease my muscle tightness. And that's the other area where CBD can be really helpful. It's a good muscle relaxant. And most of us with fibromyalgia have really tight muscles. So for me, I think it's kind of the muscle relaxant effect of CBD that gives the most pain relief effect, along with kind of that mild anti-inflammatory effect when taken systemically, and the strong anti-inflammatory effect when used topically. Now, the final area that the fight or flight nervous system really throws out of whack is our hormones. And in particular, when the fight or flight nervous system is in overdrive, like it is in fibromyalgia, it can really burn out or tire out our adrenal glands. Our poor adrenal glands are really getting pummeled all the time by this fight or flight nervous system signaling. And basically, they get to the point where they just don't have anything left to give. So they're still functioning, but just barely. And this is sort of an end result of this constant fight or flight nervous system signaling from the brain. And interestingly, CBD shows some really good effects at both restoring kind of more normal function to the adrenals and also calming that fight or flight nervous system signals that's coming from the brain in the first place. So to review, what we've talked about so far is that CBD has good anti-anxiety effects. It can help with insomnia. For some, it helps them get into deep sleep. It has general anti-inflammatory effects and local anti-inflammatory effects. It can be a good muscle relaxant, and all of that combined, the anti-inflammatory and muscle relaxant effects are really what give it its pain relieving effects. Now, if that was all CBD did, that would still be pretty good. But here's the best part. The ultimate end result of this whole chain reaction of the fight or flight nervous system gone haywire is that the part of our brain that senses pain also goes haywire. And in particular, there seems to be some inflammation in certain cells in the brain that are really important in how we respond to pain. And so what we see is this kind of localized neuroinflammation, particularly in the glial cells, which are certain cells that surround our nerves in the brain. The inflammation there is really hard to treat, but really, really fundamental in that process of chronic pain and in the process of pain amplification. So you know in fibromyalgia, the kind of volume has gone up on our pain sensing. The best analogy is like the Princess and the Pea, that fairy tale where the woman can feel a pea under 40 mattresses. And most of us with fibromyalgia can definitely recognize that feeling because our nervous system is so sensitized that even something just like a gentle touch can feel like a smack. So how do we treat that? That's actually one of the hardest components of fibromyalgia to treat. And it's also one of the areas where CBD is the most exciting because CBD has shown really good effects at reducing neuroinflammation and as a neuroprotectant, meaning restoring or improving more normal function between neurons and lessening that inflammation. So altogether, you can see that CBD holds a lot of different avenues where it could benefit in fibromyalgia. And the key to watch out for is how is it helping you? You know, as for me, I found it to be most helpful for anxiety, for insomnia, and as a muscle relaxant. That's just my experience. Keeping in mind that CBD, just like any medicine, people will respond differently to it. I definitely have found that the majority of my patients that try CBD do report benefit from it. Some people report a significant amount of benefit, some report only mild improvement, and others report no benefit at all. So keeping in mind that it's not a panacea, it's not a cure-all, but it definitely really holds, I think, the most potential to help on lots of different avenues in fibromyalgia, helping with the fight or flight nervous system overactivation, helping restore more adrenal balance, reducing inflammation, reducing muscle tension and tightness, and restoring and improving the brain's ability to correctly interpret pain signals. So, if you want to try CBD for yourself, the key is trying to find really good quality sourced CBD and to make sure that you know exactly what to look for as far as side effects and the correct dosages. So that's what I'm going to go into in the next portion, so stay tuned. Thanks for joining me to learn more about